Once again, good morning, ladies and gentlemen. If you'd like to take your seats, ready to hear Justin's presentation. Thank you. Right. It is my pleasure now to introduce Dr. Justin Havens. And Justin is going to speak to us about what is psychological trauma and is it treatable, which is a fine question indeed. And hopefully Justin will have some answers to that question, otherwise I'm sure he wouldn't have posed it. But I shall leave you now in his capable hands. And if you could give a warm welcome, please, to Dr. Justin Havens. Thank you.
Thank you, and it's a real privilege to be here. It looks like we've thinned out a little bit. I think the prospect of mindfulness, which is a bit of a buzzword these days, has obviously taken a few people away. But anyway, it's still great that I can talk to you. Originally, when Rosanna contacted me, I was going to speak for half an hour. And we spoke last week, and there was a bit more space. So I made it an hour so that we could really unpack the subject, because there's a lot to talk about. I'm not going to try and compete with the tanks when they go past, so I shall be quiet at that point. But my career, actually, I've only been a therapist working in mental health for the last 10 years. I've actually had a fairly broad career starting in REME. So, and that's for the non-military people here, that's Royal Electrical and Mechanical Engineers. So I'm more used to tanks not moving at all than moving past. But there we go. That's my joke of the day. But I'm going to be talking about psychological trauma and hopefully informing you and educating you. I wasn't actually aware that there was going to be a military component here, so I shall kind of throw in some extra bits to hopefully that will be of interest to you guys too. But it's also quite a perhaps slightly more dry talk than Mark's inspirational talk that we've just had. Which was amazing, so thank you for that, Mark. I really wasn't aware of your journey and all of the work you do for stroke victims. I think that's just fantastic. And clearly engaging veterans in that, the enthusiasm that you get and the adventurous spirit that veterans have, I think is a really great thing that you're doing. So hopefully you're not going to get too bored with what I'm talking about. I have got a couple of videos later on, and I'm going to take questions, and hopefully it will be a beneficial talk for you all. So there's probably not a lot else to say about my history, other than the fact that I've kind of was in the military, then was in commerce and engineering, and then retrained as a therapist, really through my own mental health struggles. And I've got a real passion for the whole topic of trauma and treating trauma, because it's such a key thing. And there's a lot of misperceptions, particularly thrown out by the media, about trauma and PTSD, particularly on the military context. There's this kind of perception that all military veterans have PTSD, or if you go to war or get deployed, you're all going to get PTSD. And there's been so much work done, particularly by King's College, the military mental health unit in London, which does a lot of population studies and research into this. And in the main, the military population is far more resilient than the civilian population, and you're trained for this stuff. And although where there are incidences of trauma, PTSD, and complicated issues, yes, they're still significant. But by and large, the vast majority of people transform through their military career and out into the civilian world in a much stronger position. So the other thing that's probably worth mentioning is that I do a lot of work with veterans and also some serving military folk, and between 2014 and 2019 I undertook my own research, a PhD at the Veterans and Families Institute at the Anglia Ruskin University over in Chelmsford, and that was all to do with traumatic nightmares. So I was doing a lot of workshops for veterans who were experiencing nightmares, and basically testing a technique and evaluating a technique that we're hoping is going to become a mainstream treatment. Because the whole thrust of what I'm going to say really today is all about the fact that all trauma is treatable. We need to kind of address the issue as we see it and not make it more than it is, and kind of speak with truth and fact. But all trauma is treatable, and the enduring mental health problems that some people can experience, and if you know people, veterans from the Korean War or the Second World War, there are not many around. Many of them came back with severe psychological issues, but it wasn't talked about. And the change in culture and attitudes to that, particularly with things within the military, like battle mind. I don't know if any of you have heard of battle mind in the military. No? There you go. That shows how well it's communicated. But there's been a lot of emphasis, particularly when the operational tempo was high in Iraq and Afghan. I know it's different now, in terms of preparing people and equipping people to deal with stuff. So, what are the contents of today? Well, let's see whether we can get the machine to work. Here we go. So I'm going to give you a little bit of an overview of psychological trauma and post-traumatic stress disorder, PTSD, where that label came from, what that label means. Again, people kind of maybe think that PTSD is something you catch, or some of the old attitudes of, you only get PTSD if you kind of, this was from the RAF in the Second World War, lack of moral fiber or whatever. So I'm going to unpack some of those myths, hopefully, before moving on to what are the different ways that we can treat trauma. And I'm going to talk in particular about the form of therapy that I'm trained in called EMDR, which is a bit of a mouthful, called eye movement desensitization reprocessing. Terrible, terrible acronym. But again, you guys in the military will know all about acronyms and everything like that. And some of you may have seen or heard about... Go. Harry was on Oprah Winfrey. They did a TV documentary about his treatment. So he actually had EMDR, really, obviously for the trauma that he'd experienced in his life. And he spoke really well about that subject on, I think it's a series on Apple TV. But I'm going to explain a bit more and show you a little video about what it's about. And yeah, so then I'm going to give you a short case study right at the end, which is a really interesting case study. An American, I think it was a 2-star general, actually, who'd had a lot of combat experience in Iraq, particularly, and accumulated maybe 3 or 4 years of kind of tours, and the impact that it had on him, and the work that we did to essentially treat it, which was very brief, which was very effective, and made a big difference in his life. And then, of course, we'll take some questions. So what is psychological trauma? Well, it's a ubiquitous experience. It's something everybody experiences to a certain degree. And if you think about caveman, where we came from, our ancestors, fighting the saber-toothed tiger, falling down a hole, all of that is trauma. And one of the key things I want to say is that we all have a natural ability to recover from trauma. Otherwise, we never would have evolved as human beings. And so the whole emphasis is around, yes, we all experience trauma, and that may include in civilian life, accidents, assaults, natural disasters, car accidents. Obviously, in the military side of things, you know what we're talking about in terms of combat exposure, and also accidents, a lot of accidents, I guess, is that we have a natural way of dealing with that. And that's why that's a really, really important point, that we naturally recover from trauma. And that it's only when we get this whole concept of PTSD, post-traumatic stress disorder, only comes about when that natural healing has been interrupted for whatever reason. And so you can already see from a treatment point of view, what we want to be doing is we want to be encouraging that internal natural healing from trauma. And I'm going to give you more examples of that as we go through this talk. But it's also it's a psychological, but it's also a very physical experience. And you'll know, if you've observed people who have, maybe after a car accident or something, there's a shock reaction that goes on in the body. There's also a shaking reaction, which is also kind of interesting, that is part of our natural healing mechanism. And if you observe animals in the wild who've been exposed to severe trauma, that's exactly what happens. They lie down and they start shaking. And then they get up and carry on flying around. As human beings, we've always, if a child is in an accident, we would kind of smother them and, in a way, we try and inhibit that natural healing mechanism sometimes. But trauma is also very personal and very subjective. And I remember, working with some military folk, and who'd experienced, a lot of tour, a lot of operational tours, and a civilian might think, well, that event, that's surely going to be really bad, and that, oh gosh, that sounds really bad, some kind of IED type thing. And what's interesting is when you speak to them, actually they're fine. Most of the stuff they're fine with, but there'll just be one event where maybe they made a decision that nearly went wrong, or something could have happened. And those are the events that stick in people's mind and become the problem. So it's really important not to jump to conclusions. And I think that's one of the issues if you have military or veteran folk going to a civilian therapist with no experience of military culture or military operations or the way of being, where they would tend to make assumptions. And making assumptions, I don't know if you've ever heard this one, assume is kind of a shorthand for making an arse out of you and me. Yeah, there we go. Just another little one. The origin of the word trauma in Greek is actually to pierce. So it's actually a trauma. If we think of psychological trauma, it's sort of piercing of the psyche by something extremely shocking or horrifying or disturbing. And we have, as I said, a normal reaction to these abnormal events, which I'm going to talk a little bit more about. But there's also a very automatic way that the fight or flight or fear response takes over as well. And I'm going to talk a little bit about that. In clinical terms, they kind of categorize trauma in two different ways. The first one is simple trauma, which is actually not a good label, because a one-off single incident trauma can still be very traumatizing and actually quite complex to treat. So the simple word is not a good one. And so that can still manifest in complex ways. But a lot of and those are the easiest to treat, as I'll show you later. But many people that I see have experienced complex trauma, which is repeated trauma, potentially over a long duration, which might include childhood trauma, emotional abuse, sexual abuse, physical abuse. It may also be linked in with a very extensive long-term military career where there's been an accumulation of things. Kind of big T trauma, which is the stuff that, like a car accident or an assault or whatever, and which is far more known, and that the end. It was actually one little trauma from his childhood that was actually blocking his final bit of recovery. And it's fascinating when I tell you the story. Well, hopefully you'll find it fascinating, because it's really quite surprising how that could be. Complex PTSD, as it's known, there is a lot more debate about how that is treated, and some people take the view that it's untreatable, and other people take the view that people have got to be in therapy for years, and that you've got to stabilize them. But hopefully I'm going to give you a flavor towards the back end of this, that we've made real innovations in the form of trauma therapy that make it so much easier, quicker, safer. But of course, one of the challenges is that there's always a lag between that innovation at the coalface and getting it into mainstream practice. And there's an issue there, particularly for policymakers, about how we do that. It's one of the frustrations, really, because I know what's possible when I see someone face-to-face or on Zoom, as I do these days, but that doesn't always translate into everybody else doing what I'm doing, or everybody else offering the same kinds of treatment. And I don't say that to kind of big myself up, but my career has kind of led me through this. So I have an engineering background, and you apply some of the principles from engineering into therapy, and what are the most effective techniques that you can use to help people heal psychologically as quickly as possible, and you come up with some new answers. Anyway, more of that. So a little bit just around how, called the triune brain. and that there are different parts of the brain. We have the prefrontal cortex, which is the bit that does all the executive functions, it's what I'm using right now to speak to you. And then we have some of these we have the emotional part of the brain, the emotional processing part of the brain, which is called the limbic system. And they're quite separate. And then we have the reptilian part of the brain, which is the thing that does the fight or flight, the thing that, if I walk down here and threaten someone, would cause you to either jump back, or if it's one of the army guys, probably boff me on the head. Okay? And that's the reptilian part. That's called the amygdala, and that's, again, an important part. Because many times when I'm working with someone with trauma, they know that they logically know that they're safe, but emotionally they feel completely unsafe or completely powerless or completely out of control. And that's one of the difficulties with the whole business is, many people, they avoid the trauma, they avoid looking at it because it feels so bad, and they're trying to fight it the whole time. And it's just something that you can't logically think your way out of it. And that's one of the kind of key things. And of course, particularly for blokes, we don't tend to, we want to keep going, we want to keep trying to fix ourselves, but that can be hard. I'm now going to pause. What have we got? What's going past? Ooh. Can anyone tell me what that was? It was a recovery vehicle. It's not, would that be a warrior recovery vehicle? Yeah. Mm-hmm. There we go. Yeah, I haven't heard that sound for a long time. It's quite exciting, actually. But we don't need to worry about that. That's just a little bit to say that our body has automatic responses to things. And that fear response is controlled, as I said, by the reptilian part of the brain, the fight, flight, or freeze. And that response is very automatic. And in a way, your military training is designed to overcome that. And that's why there's such an emphasis on SOPs and doing things a certain way. And if you're in the infantry, particularly, I'm sure in the cavalry, it's the same thing. That training will allow you to operate in an environment which is inherently dangerous. And yes, the fight, flight, freeze, or fumble response, apparently the F for fumble is one that's also there. So, my little box is a bit slow, actually. There we go. So that fear response is very much a normal response. And what's going on when we're experiencing all those emotions in the moment that might be a thing we can all relate to. Your brain is trying to make sense of things, and that's why it can sometimes feel as if your brain might be literally running and running and running to try and sort it out. Now, the really good news is 90% of people will recover from a psychologically disturbing experience over a period of days and weeks. And that's the natural healing process that's going on, and I'll talk a little bit more about that because it's highly linked to dreaming, believe it or not. So every night, well, hands up here if anyone remembers having a dream in the last week. Yeah, so about a third maybe. We're all actually dreaming 2 hours a night. If you set an alarm or get your partner to wake you up at 3 o'clock in the morning, you'll probably say something about your dream. We all dream for 2 hours a night, even though most of us don't, or a proportion of us, not aware of it. And that's when the brain is kind of cleaning out the cogs, if you like. From a computer point of view, it's almost like kind of defragging your disk. It's kind of cleaning things out. And the problem with nightmares, particularly after trauma, is when that process has got interrupted. And that's why nightmares are kind of a key symptom, if you like, of trauma. I'm now going to be quiet again. What do we got coming past? Ooh. What's that? Was that like a range control vehicle or something, no? Oh, what, sorry? Driving train attack. Okay, that makes sense because there was a thing on the top. The other thing I should say is my hearing isn't very good because I sat on a mortar line in 1987 with an ear defender up, and it didn't do me any good. Right. So where was I? Yes, the recovery, because this is the most important thing, because if we should always have an eye towards helping people recover rather than pathologizing or saying they've got a problem. And how we do that recovery, this dreaming is a kind of key part of the process, which we're going to see in a little bit. So the kind of normal response to an event, for some people they may want to talk about it, others they may not. Flashbacks and dreams of that event, thinking about it, some emotional kind of, we'll call it hyperarousal, so a lot of ups and downs with emotions or maybe feeling numb. But the key thing is over a period of weeks that will diminish and it will be, and the system will return to normal. And it's really only when that doesn't happen that we need to do something. So that little graph shows the time elapsed since a trauma in terms of week and how the vast majority of people generally recover. And so it's only the small proportion where there is an issue that we need to be concerned about, which is really where stuff like TRIM comes from, which I'm presuming I'll get a thumbs up from the military guys that TRIM is around. Now, again, all these things, they can become a tick box culture and all the rest of it. But the philosophy behind that is look out for your mates, and when there's a problem, do something about it. That's the philosophy. And I think in many ways it's a good one. So, this is a great box, this. Oh, hang on. And now I've gone back. Okay. So, when that natural healing recovery process doesn't occur, that's when the mind, that triune brain, the limbic system, has failed to process that event. And if it's almost like the fuse blows, and then you're kind of stuck in this perpetual state. And that's the difficulty, and that really is what PTSD is. Now, for some people, in the most extreme cases, if you say, something that happened 20 years ago, are you still, are you still experiencing that, yesterday or whatever? They go, no, I'm experiencing it right now. And there have been, cases where guys have been out of the military for years and years and years, but they're still digging in their garden, and that's true, and that's because their brain is replaying that experience, and they can't stop it. And see, as I say that, you can see, well, the solution to that is to get the brain to process the experience, and then they return back to how they were before, which is very much what treatment is all about. And so memories of the past are intruding into the present. That fight, flight, freeze response is still activated from the past in the present. So again, the kind of cliched hearing the car backfire and taking cover is kind of, it's just automatic, can't help doing it. Or going into a pub and always sitting facing the door with your back to the wall. Those are the kind of behaviors that people end up doing when they're trying to manage some of these issues. And the presence of repetitive traumatic nightmares is an indication that that material is still unprocessed. And so, and that's a kind of important area, because people don't really understand. People perceive nightmares as just something that just happens or whatever, and you can't do anything about it. But it's also something that you can screen people for and say, is this something you're experiencing? And it's a much easier thing to treat than the trauma itself, which we'll come on to. So these are some of the abnormal responses that I've just mentioned. Numbing, avoidance, talking doesn't help, re-experiencing the past, and that's the issue. And the symptoms not going away. Now, what can happen is that things can slowly get better. And for a lot of military people have that experience where, it's manageable. And then they leave the military, and there's kind of be an adjustment that can be tricky, or some other trauma later in life, which can be a minor trauma, like a car accident, kind of fires it up again. And that's an issue. So what is this thing called post-traumatic stress disorder? Well, my simple definition, it's the delayed recovery from trauma. And it has been around since, Greek times when they wrote about in the Iliad and all the rest of it. Interestingly, we knew it in World War I as shell shock. And And of course, they didn't have the words to describe it, because the whole issue then would generally be of kind of lack of moral fiber, cowardness, lack of resilience, whatever. But what was fascinating in how trauma affected soldiers in World War I was that soldiers would often shake uncontrollably and be unable to hold a weapon, which was their primary function. You couldn't hold a rifle. And officers would go mute. So it's almost as if their body was just shutting down, saying, this is enough. You've had enough. There's no more. And the primary thing that they were supposed to do is that, like officers are supposed to give orders, so you become mute, was how it manifested. And it was formally recognized really in the post-Vietnam era of the 1980s. And since then, there has been a kind of an increasing medicalization of mental health issues, which is helpful for some, but unhelpful for others. As I've said, the key kind of symptoms are around intrusiveness, hyperarousal of emotions, avoidance behavior, so not going near the triggers or whatever, and negative thoughts and mood. And it can be measured and assessed and everything else. But this is just a short excerpt from a book I read about junior officers' experience in World War I. I think it was called 6 weeks, because that was the average life expectancy. But this sense that, when they're in a combat environment, they hold everything together, but when you get out of it and come home, then that's when the wheels kind of, for this person, started coming off the bus. But again, I don't want to overemphasize the point that everyone that's deployed gets PTSD. I mean, the evidence is it's only slightly higher than the civilian population. And that's a measure of the training and resilience that goes in for military folk. I don't want to give that message at all. But this is a really interesting case. Who here remembers Simon Weston? Yeah? Now, you younger guys won't, but he was a Welsh guardsman. The Falklands conflict of 1982, there was a bad incident with a boat that got bombed, and a lot of people died, and he got terribly burned, and BBC made a very moving documentary about his physical recovery from his burns. But they didn't really focus much on his mental health. In fact, interestingly, I think with the whole of the task force that went to the South Atlantic, of which there were several thousand people, there was one Navy psychiatrist, and that was the whole of the mental health support at the time. So things have come a long way since then. But anyway, this is his story. My PTSD probably lasted about 24 years, and I can remember the day it went. I can remember going to sleep and waking up like a huge elastic band, or a huge elastic band? No, I think he said a huge metal band had been cut off my chest. And then he talked about how he'd been having nightmares after being on the ship that was bombed, as it was back then. And every night for 24 years, he was waking up, bathed in sweat, and after re-experiencing everything that happened, which is obviously horrific. And then he said one night, all of a sudden, he had these really weird dreams that were unlike the nightmares that was a replay of the trauma, where it was light, and he was just walking off the gangplank with his mates, off the upper decks, and nothing had happened. And nothing had happened and the war was over. And that was a spontaneous healing dream that he had 24 years after the event that, I don't like using the word cured his PTSD, but that's the sense of what he's getting. It left him. That it somehow discharged all of that trauma that was in him. And he said, and his life opened up after that. And in essence, that's what I'm trying to do with the treatment of nightmares, but rather than wait 24 years, you can get active with it days after a traumatic event. And what was interesting is he didn't have any therapy at all. I mean, he had plenty of physical therapy because he had terrible burns, but he didn't have any mental health support, and it took 24 years. But it took 24 years for this healing event. So a little bit more about PTSD, because again, there are some myths about this, and that anyone is susceptible to PTSD given given enough trauma, if you like. And they learned that in World War II, that there was a combat exposure, that even the most resilient folk would break down after a certain amount of combat exposure. Now, what makes it more likely? There's lots of different research about this. There's some research that says those with childhood trauma can potentially be more susceptible to PTSD, but the evidence is kind of weak. But even those with the most healthy attachments will still suffer given a high enough trauma load. So what do I believe? And that's why that's why I'm doing the talk today, is because I believe that all of these problems are resolvable, and they're resolvable in a much better way than is perceived. And whenever there's a BBC documentary, and why am I saying BBC, but it's mainly them, they always focus on mental health and veterans and PTSD. They always talk about the problem. They never talk about the solution. And and we'll hear from people later on today talking about all of the great work that's being done and the support that's available for people, so that that we don't just leave people suffering. So, but one of the key things is that there are no cookie cutters to this. It's not like you can just get someone to kind of go through a very short program. It requires, so one of the things I'm passionate about and I'm involved with is training other therapists and making sure that they're as skilled as possible. But the only thing, don't worry about reading all of that, but one of the most important things is, one of the key reasons people, anyone, military, non-military, male, female, don't go for help is the fact that they don't want to talk about it because they don't want to re-experience it, and they don't want to feel bad, and they don't want to share it, and all of that stuff, which is all perfectly understandable. And when I talk about some of the older kind of treatments, that's what you had to do. And that's generally what people think counseling is, isn't it? You go and talk. But when it comes to trauma, that's the last thing you want to do. So that's the thing that puts people off engaging with it. And sadly, also for veterans, if they have a poor experience of support, if they go and see a general counselor that's not trained in trauma, that will be the thing that they have to do, and then they'll get absolutely fed up with it. And not just fed up, they'll be, the stories I hear, they leave every session more disturbed than they went in. Well, what's the point of doing that? And it doesn't seem to help, week after week after week after week. So and really it's a difference between seeing a GP and seeing a surgeon when you're treating trauma. You don't want to, if you've got a tumor that needs cutting out, you don't want to see a GP, you want to see a surgeon. And in a way, that's what I kind of, that's a good analogy. So this original form of treatment for trauma is called exposure therapy, where you literally repeatedly expose someone to the traumatic event in a graded kind of way, so that it's not too overwhelming to start. But it's like, essentially, if you watch a horror film 100 times, it will cease to become a horror film. But it's a really hard slog. It does work, but many people can't start it, don't want to do it, or drop out. So it's not really very effective. And that leads us on to the form of therapy that I'm involved with, called EMDR, which is all about healing, activating that internal healing mechanism that I talked about earlier. And interestingly, so EMDR, as I said, it's a bit of a mouthful, eye movement desensitization reprocessing. So it's talk therapy, but you're doing this weird thing where someone moves their eyes, and you go, well, what on earth can that do? But it's actually very similar to something called REM sleep. Hands up if you've heard of REM sleep. Yeah? Quite a few of you. That's going on when we're dreaming. So your eyes are shut, but your eyes are darting backwards and forwards. And in a way, that's the engine, if you like, that powers the dream process. So this form of therapy is just making use of the natural healing processes that we've already got. It's also not a magic wand. It's been around in the military at the DCMHs. Have you all heard of a DCMH? District Center of Mental Health. I guess the guys with the colored bits, are you kind of new into the core, or are you on relatively-ish? So a DCMH is where you go if you've got mental health issues. District Center of Mental Health. And they do EMDR for those that need it. And again, coming back to it. But we're going to see a little video now, 3 minutes, which will break up my dulcet tones and hopefully just give you a bit more of a flavour of what I'm talking about. So enjoy.
Ever since that night, I just can't face going out.
I've always had a nagging sense of being a failure, of not being good enough.
My childhood was a mess. I was abused in so many ways.
I had a phobia of dogs. I avoided places where I might see them, which became a real problem.
I was so full of shame. I just felt dirty, and there was no way I could trust anyone, not even my friends.
I've tried different therapies since I was a teenager. Some made me feel a bit better at the time, but the depression kept coming back.
I would lose whole days, disconnected from the world, or feeling like I was living in a fog.
If I saw a dog, I was terrified. I would literally shake, and that would make me annoyed, as I knew it was irrational.
Everyone told me I should deal with it and move on, but the thought of telling anyone and talking about it filled me with dread. Emdr Therapy gave me hope that I can put that night behind me.
I had Emdr Therapy. The first sessions helped me understand that the way I thought about myself was a result of past experiences.
Emdr Therapy helped me to process some of the horrendous things from my past.
As we worked through old memories related to my phobia, it was like my fear button started to get switched off.
My therapist told me that it was a recommended treatment by the NHS and World Health Organization for trauma. Also, that I didn't have to go into all the details, which was a relief.
As we worked through different memories, it was like my head and gut finally started to see things the same.
We went very gently to begin because I was all over the place. But step by step, I started to feel a bit better.
When I went outside, suddenly I wasn't scanning around for danger. I'd kind of forgotten what that was like.
As I processed what happened to me that night, the images became less vivid. The shame dropped away, and I could see for the first time it really wasn't my fault.
That belief of I'm not good enough slowly started to crumble, and I realized I am okay. I'm as good as the next person.
With EMDR, I started to leave the past behind.
I began managing situations differently, and I felt the old me coming back.
I'm Lindsay. Emdr Therapy allowed me to move on.
I'm Dave. My EMDR gave me hope.
I'm Suzanne. EMDR has given me back my life.
I'm Mike. EMDR therapy was my path to freedom.
Great, thank you. And that does have a slight promotional feel to it. But actually it highlights one thing, which is many of the situations that were talked about there, we're not talking, maybe the sense that you've got from what I've been saying is we're talking about, really horrific, torture, abuse, combat trauma, really difficult stuff. A lot of those are very common mental health issues that people will be experiencing from whatever walk of life, and that healing process can still be helped using this form of therapy. And it also can be done quite briefly, which is kind of a really good thing. Let's move on to and probably the thing to compare it with is CBT. Has anyone here heard of CBT? Yeah, cognitive behavioral therapy, which is the mainstay of therapy, but it's actually not a therapy. It's a toolbox of many different things kind of thrown in there. And that's very much, if you go to the NHS, or in the main go to DCMH, for a variety of mental health issues, that's what you'll get. Now that's quite different to kind of different models of counseling, which can be a little bit more explorative and open-ended. And EMDR is a kind of a bit of a combination of the two, but with this added kind of eye movement thing, which is a bit weird, but just it's amazing when you see that working in front of you. But these are some of the things that someone said. This was from my first ever patient, actually. It felt like my brain had been taken out, washed, and put back in again. And that was someone who's, they had a massive gas explosion in their house, which literally demolished the whole thing just whilst they were they in it? I think they were in the back garden. Some of the sessions were like riding an emotional roller coaster, but thankfully it always stopped before I left the room. So yes, it can be quite a powerful experience. Before EMDR, I could only look at one part of the memory. Afterwards, I've only just seen I've got a monitor down here. Afterwards, it felt like the jigsaw had been put back together. So it's almost like memories get fragmented when we experience trauma, and that we're trying to put them back together again. Interestingly, some of you may have heard of phantom limb pain. So if someone's had an amputation for whatever reason, they still experience the limb or pain in the limb that's not there. And I also do a bit of work, well, it's a voluntary thing, with the Open University, where I mentor ex-military folk who are doing an OU degree who've got injuries or whatever. And one chap I was working with, really, really great guy, and I'm in the main, I'm just doing, helping him with his academic stuff. But he'd had a very high amputation from an incident back in Iraq, I think, high amputation of the leg. And his phantom limb pain manifested as feeling his foot where his knee should have been. Yeah, so he could feel it, and it was generally okay, fairly low level, except if he was tired and stressed or if he had a hangover, which, sometimes happen. But then when I said, how bad is the pain? He said it was, 10 out of 10. It was really excruciating. And I kind of got permission and all the rest of it. And he'd had some EMDR for some previous stuff. But we just did literally 2 or 3 minutes, in fact, it's probably 30 seconds of eye movement stuff, getting him to focus on the sensations of his foot where his knee should be. And he just closed his eyes, opened them, and said, my leg's gone. Logically, he knew his leg wasn't there, but his part of his brain actually was still seeing the leg there, and that's why he was getting those sensations of phantom limb pain. And literally, within 30 seconds, my leg's gone. And then he didn't have the phantom limb pain issue anymore. So it's kind of really interesting. It's, you can see how the phantom limb pain is a manifestation of the brain's incorrect map of the body. And if you can reset it, it has a big impact. But there we go. That's just a little story. So innovation and improvement in the field of trauma therapy is my real passion. And allowing people to be treated briefly, safely, and quickly is a kind of a key part of that. And that means that complex PTSD can be treated significantly easier and quicker. I'm not going to unpack that in too much detail, but what we're going to do now is, I think I've got till 12:10. We're just going to watch another video. This is 5 minutes long, and so this was the outworking of my PhD. So it's a self-help resource which is on YouTube that anyone can look at if you're experiencing disturbed sleep and nightmares. And this came off the back of the work with the military folk I was working with. And it highlights how you can get your own natural healing process back on track. Now, the most interesting thing is that sleep, some of the guys I was seeing were literally not going to sleep, or it would be a bottle of whiskey to get them to sleep, because they were avoiding it so much because they knew what was coming down the road. And that's obviously going to have a massive impact on their physical health and their mental health. For others, it might be, they're just, every night they're being woken at 3 or 4 in the morning and can't get back to sleep, so they then become chronically sleep deprived. But when you can get this sleep back on track, that then allows the brain's natural healing to kind of kick in. And so trauma symptoms, PTSD symptoms, reduced by, well, in my research, by an average of a half, which is really good from a self-help technique. So let's watch the video now, and hopefully this will be not quite as schmaltzy as the one you just saw, if that's the right word.
What I'm going to teach you over the next 5 minutes is a simple and practical technique to help solve the problem of nightmares and night terrors, which can include lashing out, shouting, and other sleep disturbances, any of which can lead to an intense fear of going to sleep. It's a technique that helps promote peaceful sleep, doesn't involve dredging up the past, and best of all is something that you can start doing yourself tonight. Since 2013, I've been using this tool to help people from all walks of life, including military veterans with PTSD. And I've seen many times how fixing the nightmares first unlocks a natural healing process that helps to resolve the impact of trauma from the inside out. Here's how it works. Even though we don't always remember our dreams, they happen every night. Under normal circumstances, dreaming acts like overnight therapy. As wacky and weird as they can be, they offer us the chance to work through difficult emotions and process our traumatic experiences from the safety of our beds, so that in the morning, we can start again fresh. Nightmares happen when that natural healing process gets interrupted, either because the brain runs out of new ideas and doesn't know how to move on, or because the dream becomes so intense it wakes us up. If this is happening to you, then I can tell you that you're not alone. Nightmares don't discriminate. They don't care how tough you are, smart you are, or what you do for a living. Around 1 in 20 people get them, and if you've experienced trauma, it's more like 9 out of 10. With the nightmare often feeling like a replay of the original trauma. The first thing I want you to remember is that you have power over your dreams and the kind of sleep you experience. Even if your nightmare is about something from real life, however awful, that event is in the past. What's happening in your sleep is just a dream. Most importantly, it's your dream. You're in charge. So it's okay for you to decide to change what happens, and there is nothing to fear in your dream. I want you to think about your most recent nightmare or your last bad sleep experience. You don't have to analyze what it means or relive the whole thing. Just think about the point when you woke up and what you'd want to have happen next in the dream that feels good. Take some time on this. What we are looking for is a new direction for the dream to take. Something brief and simple and just as powerful as the nightmare. Something to kickstart the dream, to remind your mind that it's okay to stay asleep through any dream. Or, if you don't remember your nightmares, something you could be doing that would help get rid of the unpleasant feeling or sensation you wake up with, so that all-important healing process can complete its work. Here is the second thing I want you to remember. Whilst they may feel very real to you, dreams don't follow the same rules as real life. So, your imagined solution doesn't need to be moral or peaceful, or something that could happen in reality. Perhaps your solution might be a way to gain complete power and control within the context of the dream, or it can be something that seems totally unrelated. It can violate the laws of physics, be surreal, or feature fictional characters. It can be violent, it can be pure fantasy, or even a little bit silly. You don't have to defend it or explain it to anyone, and if you find that it doesn't work for you right away, don't give up, because you can replace it the next night with something that will. Whatever new idea you decide to put on your dream shelf, it should ring true to you at a gut level, as something positive, something that is at least as strong as the worst part of your nightmare. Like a powerful memory from your past. The stronger the feeling, the more it will propel your idea into the dream. Write down your solution, and just before you go to sleep, read it, imagine it, and think, this is what I want to happen in my dream. It sounds simple, but there is a lot of evidence to show that it works, and that by starting tonight, you could see immediate improvements, or even have the best night's sleep you've had in a long, long time.
Splendid. Hope that made a little bit of sense to you and kind of explained things. That's on YouTube if you want to look at it. it's been downloaded, well, we translated it into about 7 or 8 different languages, and it's been viewed about 80,000 times, which my kids tell me is absolutely nothing, but there we go. But yeah, if you come across anyone that's experiencing nightmares, the problem is people will never generally say, oh, I'm having terrible nightmares at the moment. Please send them the video, or you can just find it by sticking my name in on YouTube, or putting in dream completion technique is what we call it. And I've trained an awful lot of therapists in using it, because if you see, the first time I see someone, if they're having nightmares as a result of their trauma, we'll clear up the nightmares first. That helps the sleep, makes them feel better, and also starts cleaning up, gets their own natural healing processes back on track, which is a good thing. So, will the next slide come up? So, we've got 10 minutes left. I'm going to spend 5 minutes on this case study, and then we've got a few minutes for questions. Hopefully it's not been too boring. Hopefully you've learned something, and hopefully it's maybe perhaps dispelled some of the myths around trauma and such like. So this was someone I treated over Zoom a couple of years ago, 2 years ago, I think. In fact, this whole pandemic thing, we've seemed to have lost a year, I think, but there we go. So I think he was a 2-star general when I saw him, but he had, as a company commander, kind of spent maybe 4 years or so of accumulated tour experience back in the 2003, 4, 5, I think, around there. He had a very high score for PTSD. He was exhibiting all of the signs and symptoms of post-traumatic stress disorder, but he was still fairly functional if he worked 14 hours a day and kept himself extremely busy, so his brain wouldn't wander back to these other things that he'd experienced. He had nightmares, flashbacks, and he would avoid any confined spaces. Yeah? And I'll explain a bit more about that in a bit. And when he did go on holiday with his family, they were very difficult because, of course, he's not got all of that stuff to focus on, the work, and then the nightmares get worse, his irritability gets worse, the sleep gets worse, his mental health goes down. So, yeah, very difficult. And we only had 6 sessions of treatment, and this made a dramatic difference. The first thing we did was resolve the nightmares using that technique you just heard about. Then we use this other technique, it's called the flash technique or the blink technique. Don't worry about the names because it's not something you need to remember. But this is one of the latest innovations in trauma therapy where the person doesn't need to think about or feel the trauma experience. You can actually get that healing process back on track so that the trauma feels less intense and further away, which is what you want to happen, without doing any of that. And you can do that again in session 1 or 2, and it's just a fantastic approach. And I use it all the time. Had quite a few cases recently of traumatic bereavements linked to cancer and COVID and all the rest of it. And it's just beyond people's realms of expectation that something could change in their mind within an hour of spending an hour with them. And so, again, it's an area I'm passionate about. I'm involved with training therapists in it and doing research. But it really is a significant advance. The difficulty is it takes ages to kind of get through into the mainstream, but that's a separate kind of issue. We then also did EMDR therapy, and of course, what it's important to realize is, in 3 or 4 years of experience, he had hundreds of what might be labeled traumatic experiences, but that's not the issue. It was only certain ones. There were maybe, I think, 8-ish that were still difficult, that was still difficult for him, that was still unprocessed, that was still still very vivid and still very intrusive. And that's what we then cleared up. And I followed up with him, a year later, and absolutely fine and absolutely changed. And that's just from 6 sessions, so relatively small investment of time and money to make a big difference. But this is the interesting bit, is that we probably got 2/3, 3/4 of the way through, and there were some incidents involving confined spaces. I think they were recruiting local police in experience. And we couldn't get that to clear. The natural processing, the eye movements, it wasn't fully shifting. And we did a bit of jiggery-pokery, shall I say. And what popped up out of his mind was an experience when he was, I don't know, 3, 4, or 5 years old, where his brothers locked him in a cupboard. So that's what I mean by those little T trauma experiences. He had forgotten that, but it popped out of his mind, and then when we resolved that very quickly, the residue, if you like, of the military trauma resolved itself. Can you see how there'd be a connection, you know, being locked in a cupboard and, you know, being in a confined space and something bad happening, yeah? So, and it's not always like that, but it's an important part of your clinical skills to be able to find out, to troubleshoot what else might be going on that's stopping that healing process happening. But there we go. But and that was really the last piece of the jigsaw. But fascinating. And this is what he wrote afterwards. You know, spent a total of 43 months deployed. He hadn't discussed it with anyone because, you know, the culture is, you know, crack on and all the rest of it. And, you know, he said that his mental health was the best it's been for 15 years. So that was just really good. And, of course, not everybody has the same response to that. But that was just a good example of how using the latest and newest approaches in a sensitive way took him through a healing experience that was brief, effective, and not a painful experience for him. So, what are the conclusions from today? Hopefully I've given you some insight into psychological trauma, what it is, some of the myths around it, how it's treated. You know, I'm not saying I've taken out a few slides. I'm not saying that EMDR is the only approach. There are lots of different approaches to treating trauma. But, you know, as I said earlier, my kind of enthusiasm for it is trying to find and evaluate and to meld together the best approaches together. And I really think that, you know, we're making a lot of progress there. Key thing is always treatable. So if something happens and, you know, a week or two later it's still kind of knocking around or whatever, you know, think about doing something about it. Certainly if you've got nightmares, which is a common symptom, then, you know, that's an indication that something's not quite passing through your system. And of course the nightmares can get better on their own, as Simon Weston experienced, but don't wait 24 years. So there we go. That is my talk. If anyone wants to email me, they can email me, and that's fine. And I'm happy to take a couple of questions. Look at that, we've got 3 minutes left. That's not bad, timing-wise. So it's been a pleasure to speak to you. I wish a few more had been there, but I think the lure of mindfulness, I think it's being recorded, so maybe the others can watch it if they want to. But hopefully it's been informative. Any questions? Yeah, we've got two. Oh, hang on, we've got a microphone. Someone, I think. There you go. I'm presuming your first name isn't Padre, that you are the Padre.
Yeah, I just wondered, someone that doesn't suffer from PTSD, but I'd class it as burnout, where you've been introduced to so many things over the years, and you sort of file it away in your memory and try and forget about it, you know?
Yeah.
But it doesn't affect you in that way, but you get to burnout where, you know, you're physically sort of drained at the end of it.
Mm-hmm. So that, for me, would sound something like, you know, it may not be categorized or diagnosed as PTSD, but it's still probably the effects of stuff happening and an overload in your system, which I would still call trauma, and I would still treat with EMDR. And that the body, there's a famous book by an American guy, but the body keeps the score, you know. And I think you mentioned you physically feel that. And so it isn't just about healing the mind, it's about healing the body, and it's all kind of together. So, you know, I would happy to speak to you afterwards to maybe connect you into local resources or whatever, but it's worth looking at. Padre.
It was just a simple question to ask you. Are you still working with the military, and where do you practice? Where are you based?
Okay, so I'm based up in near Cirencester. So I don't work with the military. I've done work for military or veteran organisations. So, and interestingly, the last two people I had through, I think, the Royal Marines charity were You know, again, they'd had buckets of combat experience, but their issues were not related to that. And that, again, that's the, you know, the misconception. They were more general mental health issues around depression, anxiety, and the stuff of life. But there we go. So, but I also I only work on Zoom now, which is still, for doing this kind of work, is still effective. So I can see people anywhere in the world. Yeah. Does that answer your question? That's a simple question, that one.
We'll take one more question.
Yes, yeah.
Thank you for your very informative talk. My question is about the new technique that you mentioned, where the individual doesn't have to talk
technique,
about
yeah.
about their trauma. I'm just wondering whether there are any studies to show how long the stability lasts. Or the improvement,
yeah,
how
there
long
are
it
some
lasts.
studies and some papers, but generally it's permanent. You're looking for a permanent shift in how stuff is stored in the mind. Yeah, when I train other therapists, we do live demonstrations. It's just fascinating that stuff can shift very, very quickly without having to confront the trauma, which if you're dealing with people, and we generally use it in the most intense stuff because that's the hardest stuff. So, you know, I don't need to kind of, yeah.
Yeah, sorry to interrupt. So I work with the mental health team, and we
You work
do
with
have
a, sorry?
Mental health team.
Okay, yeah.
And I've had a number of patients who have had therapy, of course not veterans, who have had, you know, trauma for childhood experiences,
Yes.
you know, and they've come back and said that they've been in therapy for so many sessions, but it's not worked. Of course, they were not trying the flash technique, but then I was just wondering about how, you know, you talk about a permanent shift.
Yes.
And is that something that is actually possible with
Yeah,
this
definitely.
technique?
Yeah, that's why I say all trauma is treatable. I mean, it's, you know, the case study of the Army officer, if, you know, I wouldn't stand here saying it's permanent if I mean, there'll be certain things where, you know, it may be re-triggered again potentially, but it's not about just ameliorating symptoms, making people feel better whilst they're with you, sending them off, and then it all comes back. It's, you know, you're changing. And they've done the brain scan imagery. You can look at the portions of the brain that are affected by trauma and all the rest of it. So yes, I mean, that's what the research is there to show, that you're looking for a permanent change. That's the goal. I mean, the rest of it, you're wasting your time if you're not looking for that. Anything else? Anyone else? No? Yeah, time is of the essence. Great. Okay. Thank you very much.